Hello, good morning.
Am I with Mrs. Christina, the mother of Daniel?
Yes.
This is Dr. Noor, one of the children's doctor here. How are you, Mrs. Christina?
Yeah, I'm okay, doctor.
Today I am here to ask you a few questions about Daniel's condition, as I received a letter from GP. Is this a right time for you?
Yes, doctor.
Okay. I will also take some notes. I hope you don't mind it.
Okay, sure, doctor. No problem.
Can you tell me what is problem with Daniel's health now?
Yes, doctor, Daniel is 7-year-old and he is already having some issues regarding his development. Since like a few months, he's not having his food. He's refusing his food. He's vomiting. So I'm not able to feed him properly. And so in spite of, because of this, he is not gaining weight also. So this is worrying me so much, doctor.
Can you tell me more about the vomiting? Is it just milk what he is drinking, and what else? Anything else with the vomiting?
Yeah, well, doctor, because of his feeding issues from the very beginning, he's on that NG2. So basically, we are giving more of the milk only. So most of the milk he's bringing out.
Okay. You are using any thickeners with the milk to make it thick?
No, doctor. For occasionally few feeds we have been using, but since his symptom has been increasing, we are going only for purely milk.
Okay. From how long this symptom is going on with him? Vomiting?
Very beginning only he had some feeding issues, but this vomiting both through the tube and through mouth has been increased since 2 months.
2 months. Okay. Can you tell me about his weight gain? How was it before and how is it now?
Before he was okay, there was a constant weight, but now there is a fall in the weight since this 2 months when the condition worsened. His weight is very low.
Okay. From the GP letter, he wrote it as 0.4 centile. That's what I know.
Yes.
Okay. I want to ask, what is done so far for this? From 2 months, it's increased and you're seeing that he's losing the weight. Anything you did recently for his condition?
Yes, doctor. We have been visiting the doctor. So he is already on some medications to be given. 2-3 medications they are given to prevent this vomiting. But in spite of that, it's still happening.
Do you remember the names of these medications?
It was some omeprazole or something like that, doctor.
Okay. Apart from omeprazole, any other medications he's taking for any other condition?
Yeah, he was having some fits, so he's on sodium valproate also, apart from the omeprazole.
Okay. For vomiting, he is on anything?
For vomiting also, they have given some medicine, but I don't exactly remember the name.
Okay. So now I want to ask you, any allergies he has to the medications?
No, doctor. So far, there are no allergies.
Okay. What about his shots? His shots are up to date?
Yes, his shots are up to date.
Okay. Can you tell me the team, I mean the doctors whom you are following up with for his condition?
Yes, because of his this developmental issues and issues regarding the birth, we have been seeing the doctor who is treating his food, basically the gastroenterologist and dietitians we have been seeing, and the physiotherapist, and that's all, doctor.
Okay.
And for this fits, we have been seeing a neurologist also.
Okay. I want to ask about his nutrition. Apart from the milk, anything else you are giving him?
Some vitamin supplements, that's all. But when the symptoms has been increased in the last 2 months, we have stopped that.
Okay, you are giving only milk. And did you contact dietitian for this recently to know the milk quantity or any changes in diet? Did you contact?
No, doctor, we had some issues at home. So since last few months, I was not able to contact the dietitian.
Okay. So I want to ask, during these 2 months, any behavioral changes you see in him?
Yes, he has been very irritable because of this frequent vomiting and not able to take his feeds and not able to satisfy his hunger. So that has been affecting his activity and sleep.
Any abnormal movements?
Abnormal movements in the sense, yeah, after feeding, he has been having some arching of his back and stiffening. That's what we have noticed recently.
Okay. This is the first time this is happening in 2 months, or before also it used to happen?
No, when the symptoms, this condition vomiting has worsened, that time only this abnormal arching and all has been happening.
Okay. Does he has any concerns regarding his hearing, vision?
No, doctor, his hearing and vision is fine. Only thing he has one squint in the right eye.
Okay. For you, this you are following up with the eye doctor?
Yes.
Okay. So anything in the chest your doctors told before regarding his heart and lungs, any cough or any symptoms?
No, doctor, but when this 2 months when his symptom, this vomiting and this has increased, that time he is coughing more and he has some noisy breathing as well. Otherwise, there was no history of any
Okay.
infections in the chest.
Any recent fever?
No, doctor.
Okay. Can you tell me about his poo?
That's fine. That is, he's doing normally.
Okay.
He has initial some difficulty, but with the medication, it is controlled. Constipation was there.
Okay. Any constipation? Okay. Any medication you're giving for constipation?
Yeah, we have been given this movie call that I am giving him regularly. So with that, he is fine.
Anything about the pee you want to tell me?
That's normal, doctor. No complaints.
Okay. About his limbs, because I know that he has the quadriplegic CP. So anything you see, like any problems like contractures or anything you're following up with the doctors for that? Any problems?
Yes, that was there from the beginning. A little bit stiffness and contractures were there, and we contacted doctor and have been started on exercise. So he's doing okay with that.
He's following up with the physiotherapy regular or no?
Yeah, only since a couple of months we are not being able to do, but otherwise he was regular on physiotherapy as well.
Okay. Any skin changes you see in him?
Only some redness is being there because he's constantly lying down. Other than that, no skin
Okay,
changes.
redness, you mean in the back buttocks area?
Yes, yes.
Okay. Since you said 2 months, he was, sorry, from the letter I got to know that 2 months he was in neonatal ICU. Can you tell me about your pregnancy? Any problems during the pregnancy?
Pregnancy was normal, doctor. The scans and all was fine, but he was born earlier. He was born at 27 weeks.
Did they tell you what's the reason for that?
I had a bleeding. So after that, they told for the safety of the baby and the mother, he has to be delivered fast, and they did the surgery and took him out.
Okay. So after birth, how was he?
Yeah, he was weak. He was very tiny, and he was not able to breathe. So they had to keep him in the ICU for a few months,
5 minutes.
basically 2 months.
5 minutes.
Do you remember his birth weight?
5
Birth
minutes
weight
left.
was
Okay.
around 630 gram, doctor.
Okay. So he was kept in the neonatal intensive care for how long?
It was for a few weeks. I remember around 8 to 10 weeks. After that, he was shifted to the ward.
Okay. In the family, anyone has the similar condition?
No, doctor. Everybody is fine.
Everybody is fine. Okay. Siblings. There are siblings for the Daniel.
Yes. I have a baby now who's 6 months old. Younger baby.
Okay. Are you facing any problem in taking care of Daniel?
Yeah, so now I have to take care of the small baby as well. So it is being a tough time for me because Daniel also require most of the attention and time will be spent on him. So managing both the kids have been a difficult time for me. So
You and
recently.
your husband are working?
No, doctor, I am not working, but my husband is working.
Okay, so it's a issue for. Are you connected to any social groups for this cerebral palsy?
Previously we have been connected, but since we have recently moved to a new place, we are not in touch with them. And also with the new babies and busy condition at home, I have not been able to cope up with that.
Okay, financially, are you any problems with the financial status? Do you have any issues?
Yeah, we are able to manage, but still a bit of difficulties are there to see it off all alone because Daniel also requires so many medications.
Okay, thank you so much for it. I want to know about the development. Presently, what Daniel is able to do? Is he able to sit or roll over or stand anything?
No, he's he's able to roll over, but not able to sit without support. Yeah.
Okay. Regarding his vision, you said squint. Can he fix the objects?
Mm, yeah, he fixes the object, but only follow to a certain extent.
Speech, is he talking any few words or anything?
No, doctor. He usually makes sounds, and that's all what he indicates. But he can smile.
Any expressions he does, sadness, happiness, like this?
Yeah, he usually shows his displeasure and unwillingness by his actions.
Okay. Any admissions for him in the past?
Previously, one or two times he has been admitted for some mild fever, and that's all, doctor. There are other no serious hospital admissions or long duration admissions are not there.
Do you remember the age when he was told that he has this cerebral palsy? The
Yes,
doctor said
yes, it was by 1 year when he was not able to stand up and not moving like other kids. That time, doctor told that he has this problem.
okay, anything was done? Any scan or anything was done?
Yes, doctor. They have done so much blood test and scans and all to know what is happening with him.
Okay. Most of the things I got. Anything you want to add which I missed if you remember, Mrs. Christina?
No, doctor. These are only my concerns regarding his weight gain and also every feed he is vomiting. So, if anything can be done about it, it would be very grateful.
Sure, we will discuss with you the full management plan for him shortly. Since now we extracted everything about you. So time is there or finished?
Half minute.
So apart from these medications, omeprazole, anything else you remember for his vomiting you are giving?
Basically, what they have told was to give this medications and to make him sit a little straight and then give him the feeds. So that's what we have been doing. But now he has been vomiting through the NG tube also, the feeds given through NG tube.
So nowadays you have...
Time over.
Okay. So maybe even I missed some points, but I tried to cover more. Okay. Anyone, but I will present the case to her and then we will discuss. Okay. And complete whole management and then. Okay. Today I took history from Mrs. Christina, the mother of Daniel, who is 7 years old. He known case of quadriplegic cerebral palsy, presented with vomiting and acute episodes of vomiting and weight loss over a period of 2 months. He is on several medications like omeprazole and on sodium valproate for epilepsy And these vomitings were associated with abnormal movements like arching of his back and some staring, but no and he has significant birth history with born at 27 weeks gestation due to bleeding during pregnancy of the mother, and he had very low birth weight, which is 630 grams, for which he was kept in NICU. Then he was diagnosed as cerebral palsy when he was 1 year old, when he was not able to stand up and lying down. Apart from that, his developmental stage at this time is he's just rolling over and can hardly fix the objects. There is difficulty and there is a squint, and has expressions like smiling and sadness, and says very few words. There is no family history of similar condition. Regarding the social, there is a small baby at home of age 6 months. So the mother is taking care of the baby, and there is she's under depression, and there is a chance of negligence of the child. Actually, this is a difficult history. I just wanted to try. Maybe if I do, I will also be like you. That's why.
Always CP history.
Yeah,
but still
yeah.
I wanted to try. That's why I thought, okay.
No, good. See, I am also, see, there are 67 participants. When you did, there were 80 participants. And we know, we all know that our levels, despite I prepared the case, still it is difficult for me. You know, we have to practice summarizing. That's why I always tell summarize in the group, which I myself is not doing. From today, I will start writing to the summary of each case, because in summarizing, even I am weak. Okay. So no problem. So you can ask me about the questions for management. Then we will open the floor for others to comment. Okay. So that we will get to know what mistakes I did and what mistakes you did. Okay.
Yes. Okay, okay. You can go ahead with the diagnosis and differential diagnosis.
Give your differential diagnosis, Dr. Noor.
Yeah, my differential diagnosis is one severe gastroesophageal reflux disease. Okay. Or I can say uncontrolled gastroesophageal reflux disease. The second thing is neglect. There is some part of negligence to the child, which is playing a role here. Another, maybe we have to rule out the infection as a cause in this child, because there is some coughing, and he has possibility of admissions with chest infection, and GERD can cause aspiration. So because of these reasons, I want to rule out also any chest infection or any other source of infection in this child. Okay.
Okay.
How will you manage the patient?
So the management is, I will do the complete physical examination of the child, especially the gastrointestinal, abdominal examination, and also review his medications and see the doses and try to correct the doses if it is correct or not. And also I want to do some labs, especially to rule out there is no infections like CBC, CRP. And also I want to review for the psychological condition of the parents, and also social support for this child. For the reflux, I want to do some tests like pH impedance study. Okay. And also upper GI endoscopy.
Okay.
And in the management for the child, I want to take some non-pharmacological and pharmacological. 1 minute, I will mute all.
Just mute.
Okay. In the pharmacological, I want to, that's what, he's already on the omeprazole and Gaviscon and some medications. I want to review the doses along with, by referring him to the gastroenterologist. And I want to give them an option of surgery, such as gastrostomy and either the gastrostomy tube feeding or fundoplication. Okay. So any other questions you want to ask?
What other team of professionals would you like to involve for especially this kind of child?
Yeah, I want to involve the physiotherapist because he has some contractures, and physiotherapist and occupational therapist and dietitian, especially to see whether the quantity of milk and the quality of milk what he's taking is fine, and any other feeds. So dietitian input is very important. Since developmentally he is very back, I want to involve all the speech therapists, and for the social support to the family. And since there is a small child of 6 months old, I want to offer some respite care also to them.
Okay.
And for this condition, mainly I want to involve the gastroenterologist, and here is also an epilepsy and sodium valproate, but it is well controlled, but still he will be following up with the neurologist as a regular follow-ups.
Okay.
And also for the musculoskeletal orthopedic.
Oh, good.
Anything like that? A long
Yeah, that's
list.
enough.
This one.
In the social sport, you can add some like social sport is for the parents, for the family. So arrange respite care and arrange holidays, some social admissions, socially and financially support. Each and everything you can add.
Yeah,
Otherwise, not fine.
yeah, we can admit this child because also there is acute fall in the weight also, no? And
Yeah.
we can admit him to observe his feeding and review his medications, and for the social reasons also. For these
And
three we can
yeah,
admit.
and need for nursing care also, as doctor mentioned that there is some bed source.
Yes, yes, yes. So also the option is we can give as admit this child because he may need to be observation for feeding because there is acute fall in the weight and continuous vomiting, poor feeding. For the observation of feeding and reviewing his medication and giving him and explaining the parents the need for the surgical interventions like gastrostomy tube or Nissen fundoplication, because if the medicine what he is taking is up to the maximum dose and he's not responding, the next will be the surgical care for him. Okay, so
Yes.
you can tell that to review his medications for the doses or to offer the surgical
First,
options.
first you will involve also the dietitian. Maybe
Yes.
he can, yeah, he can add some different kind of foods and high caloric diet, as child is not gaining the weight. Further, he is losing the weight from couple of months. So high caloric diet can be added.
Yes, high calorie diet. So dietitian is main role here. You have to ask about the nutrition of the child in the history. It is very important. So whatever they say, it's not the thing. But you asked or not, this is main important. No, she said only milk. It doesn't matter, but we have to ask. Nutrition.
In the
Any
labs,
dietitian was
in,
involved recently is also very important.
in the labs, I will add, as you told, CBC and CRP. Dr. Deepa told the same things. Urine complete and culture sensitivity should be added also.
Yeah, because we have to rule out the infection in this child, very important,
Yes.
as a cause
Yeah,
of this
that is.
vomiting, along with
Yes, that
CRT.
and the chest X-ray you can add to rule out the infections.
Yeah.
And one thing in the differential diagnosis, Dr. Deepa said severe GERD, gastroesophageal reflux disease, and quadriplegic associated with pseudobulbar palsy. That is too fine. And you told that gastroesophageal reflux disease and some maybe aspiration pneumonias recurrent.
Infections, yeah.
Another one, uh, if you, as you are asking for deeper to at least set 3 differential, One is coming in my mind, and there is open mic now. Anybody can comment. I think they should be, if you want to adjust, well, sodium valproate toxicity, that uh, hepatitis,
Okay, I think the
SGPT.
medication, it will cause malabsorption, alter the metabolic process of the body, which including
Yes,
anti-epileptic as well as proton pump inhibitor. It will change the metabolic process of the body, so it has a role in malabsorption patient with CB.
Hmm.
yes,
Medication per
as
se, particularly for bone. It will affecting
yes,
mainly for for the osteopenia. This omeprazole
yes.
and the anti-epileptic, it's mainly affecting the bone health.
Hmm.
And SGPT level should be done also.
Can we, I believe that sodium valproate will cause more of weight gain, and there is no history implying of any sort of jaundice. So saying
No, no,
sodium
I am just,
valproate,
you will rule out, you will rule out by saying this, sodium
Yeah,
valproate will
more
increase the,
than that, why you, what about the neglect? I feel neglect is also
neglect
one
is
of the
an
reasons
important
here.
reason.
neglect is also, yes, definitely
Because
neglect is
six
there.
months child, for a CP child, you should keep him in
Yeah.
a right position. You have to feed and you have to give him time. And I told the recently, and she told that the physiotherapy is stopped, and also there is cough. There can be chances of aspiration as well
Mhm.
because of the GERD,
Yeah,
and there is no good physiotherapy for him. And I asked also, did you follow? Are you following up with physiotherapy? She said from couple of months we can't. The reason is the small baby. So
Mhm.
neglect also you have to put it here. And also if
yes.
I would have asked, actually even I did not ask maybe about the behavioral changes. If Deepa would have asked me, I would have told that nowadays he feels more angry, because again, even if he is not speaking, but still he has expressions in him. He may see that to some extent the mother is not giving him attention. You know,
Yeah.
some CP childs, they will have all expressions. I have seen crying loudly,
Yes, yes.
shouting,
Maybe the mother
waving
she
their hand.
prolonged the period of she's spacing the feed for him, and was
Yeah, maybe.
longer, and he will be more irritable and
Yeah,
And
yeah. And
angry.
when,
also because he's not taking enough feed, maybe a component of hypoglycemia also will make him agitated.
one
Also,
more thing,
impairment
when
of
you
the
were,
GI muscle tone. It will be a role in malabsorption also.
Hmm.
and when you were asking this about the birth history, one question should be asked, this jelly skin of the brain was done at that time, or should we rule out what is the cause behind this quadriplegic CP?
Hmm.
That question should be
Here
asked.
it was, yeah, okay. I did not ask. I do agree with you, because, but here in my mind, I presented as hypoxia as the cause. So he had immediately after birth on the breathing machine, and then on tube machine
Even,
like this.
yeah, even then you should ask if
Yeah,
there will
yeah,
be
I
a
agree
HI,
with you.
yeah,
For
HIE,
bleeding,
that can be picked up by that
which
changes.
one? Jelly scan can pick up what you're telling?
Leukomalacias, if are there, periventricular leukomalacias or something like this.
Okay, yeah. It means
Yeah,
the
that
bleeding.
can be picked out. I'm just saying that where
Yeah,
you are
yeah, you're
asking
right.
about the
But the
birth.
thing is, you what you will ask, how much
No,
you
no,
will ask.
no. Actually, you were asking about the birth weight. Birth weight, okay, that's good. But as she told that she was 27 weeks, so no need of go for birth weight. If you want, okay, that's good, that's fine. You can ask at that stormy period, jelly skin of the brain was done that time, and what doctor told you. And one more question, simply open-ended question that can be asked, like, describe me more the journey of illness till now. So the role player will tell you that she has been admitted before, or she has been on some medication. She was having this seizures. Each and everything she will tell you. So it will save your time to ask again and again question about the pneumonias, recurrent pneumonias, and other things. She will tell you. Then you can ask others these complications which you have asked one by one. Maybe she will tell you each and everything. If some things left, you can ask. about other complications. So just open-ended question. That's why I love this open-ended question. Just
Can
ask,
you repeat the question again? What you said?
describe me his journey of illness till now.
Oh, yes, yes. Okay.
This is very open-ended question, and this is not from my side. This question, I have listened some video for CP in the UK. So that examiner asked this candidate asked this question: describe me his journey of illness till now. So mother told each and everything. Mother took maybe 2.5 minutes to tell each and everything what's happened, what we have done, what's MDT team has been involved so far. So it saved time a lot.
Dr. Noor?
Yes, you are right, Doctor. Yeah, see, I prepared this. Really, it was an headache history. This history caused me headache actually, but still, I am planning from 5 o'clock. My time extended up to 6. Despite of me preparing, still presenting for me itself is difficult. So, CP history is something which we need to to make ourselves organized to what to ask and what not to ask, and where to spend time and where not to spend time.
Like in the development, just you have asked very nicely the level of activity he can do independently in terms of walking or talking, and how he's communicating with Dr. Deepa asked.
Actually, we all know that from the GP's letter will give you lots of clues to ask what question to be asked. Like, for example,
Yes,
from the GP, you know that he is 0.4. Presently, he's 0.4, but you will ask him about the previous. How was it?
yes,
Did it go down? This is more important. Don't ask about the present centile. Ask about the previous centile from his.
yes,
And the another clue from the this what you have got is this development. Quadriplegic CP means obviously or his four limbs are paralyzed, right? He will not walk
yes.
for sure. So don't ask
Mhm.
about walking. Ask about, just give them the clues, like is he sitting or
No,
rolling over like this?
Dr. Noor, if you are going for UK candidate, this patients, quadriplegic CP, they are walking even. I will tell you.
By physiotherapy mean the
Yeah,
treat.
by physiotherapy and some operations done by this orthopedic. There is a very famous this 10 years, I think, or 12 years old boy. He's coming in exam most of the time, and even in YouTube is present there. He's having quadriplegic CP, and you cannot even if you will see his video, you cannot pick. He's walking like a normal boy, but he's quadriplegic CP. When he's running or walking, you can then only you can feel there is something in walking. Otherwise, he's looking very nicely.
So
So
this
you
is
cannot say.
yes.
So that's the reason you should ask that about the level of activity he can do independently in terms of walking or talking. So she will tell you each and everything what he can do. So that's will be open-ended question, and she will give you each and everything. So no need to go further. Ask each and everything for the development. So this is
Yeah,
2 or 3
because in
open-ended
this
question will help
station,
you.
you have to cover all the 4 aspects of development. Development, you just cannot go ahead in this station.
Yes,
Because
that's why
here,
I'm saying.
they will undermark you if you don't ask. Birth history and developmental history in all the other cases we did was not much important before. But in this case, you have to give time for birth history and developmental history both, and you have to explore all the 4 domains of development.
For
So
that, I'm saying make open-ended question that she will answer you. You save your time. There are 4 things actually which you are telling. This is 4 things in CP child. You have to ask about the development history. You have to ask about the birth history. You have to explore the complications he may have, and the social history. These
Uh,
are the 4 things.
yes, and as you mentioned, the functional status, like this patient motor functional classification system for this
Yeah, that
quadriplegic, it's maybe 3, at least 3 or lower. It's not 4 or 5. 4 or 5, they are non-ambulatory.
Actually, there I can repeat that one functional classification. That is we called gross motor functional
Gross motor
classification.
functional classification system.
Yeah, the first one is clumsy child. That no need of any assistive devices. This is his only clumsy child. And the second is walk independently, but limited. And the third one, third level is walk with assistant mobility devices. And the fourth one is self mobility limited, even with assistant devices. The fifth one is no self mobility even with devices. So this is coming in the fifth. Like the mother said that he's on the bedridden and just rolling up. So this is coming in the no self mobility even with the devices. So this is coming in the fifth gross motor functional classification.
Dr. Noor, when you started this presentation, what was the differential diagnosis that you had written on the side before you started? What was
My
in your mind?
differential diagnosis was GERD.
Hmm.
Severe. I wrote it severe because because there is also the Sandy-First syndrome, the features of Sandy-First syndrome. Okay, like arching and some abnormal movements and sounds. And I wrote my second is neglect.
Okay, and the third one?
Infection. Any infection we have to explore.
Okay, and the fourth one?
Maybe chest infection I will go, because in the history only where I got the clue was the coughing. She told me that the child is coughing.
Okay. So did you write about the dietary? How far, can you summarize the dietary history? Because, you know, I came in and out. Can you summarize what you took in the dietary history in a few
No, I
sentences?
just asked about the dietary history, what diet he's taking by this. He's on NG tube and oral feeding both. Mother says that he takes only milk, and he was on the vitamin supplements, which recently even that is stopped, and orally he has stopped taking, only by NG tube he takes. And I asked about the dietitian review. They did not do recently, again because of the social cause.
Then I think in your differential diagnosis, like how, you know, when you are saying your differential, you've taken the history, but when you're telling the differential diagnosis, you can say GERD, you can say the infection, you can say the neglect, and you can also include the dietitian component where, you know, on examining the diet, this is a 7-year-old child who's been taking milk for the last so many days. The diet has not been regularized. So the diet needs to be regularized. But then even if we regularize the diet, the problem is the child is already having GERD. So I think whatever you are taking as history, if you can verbalize that, your thinking process to the examiner, that would be very helpful. Okay. And I'm sorry, just a second. Yeah. Yeah, so that is something that you can say. Dietary history is something that you can include. And of course, what Dr. Deepa was saying, pseudobulbar, ongoing pseudobulbar palsy can be a factor which causes GERD. So this can be said, like the same thing which you said as 3 points can be said as 5 points. And one last thing is that increased, as it is, this child is a CP child, there is increased metabolic demand. So whenever there is when there is weight loss, the only causes is there isn't proper intake or there is increased metabolic demand. So I think that can be said as the last point. And I think then the rest of it is all okay. This is what I had said. Did you mention anything about the dental, when you, the history? So if they ask you what is the history for neglect, you can say the ulcers around the weight loss, and plus the fact that they're saying that they're not able to have a regular review, and the fact that they've had a new child and they require support. So that when you speak it out, when you tell your thought process, I think that might help you to fetch more marks, or at least psychologically the examiner will feel that you really, you know, there will be more structure to the way you're presenting when you're presenting.
I do agree. In this history, there is lots of social components and also the medical component. The medical component here is he already has GERD before, for which he's on medication, that is omeprazole, and he's on NG tube feeding already. Okay. This is the medical problem. Now, along with this medical problem, there is social problems which are too much, like the small baby at home. Because of that, the mother cannot concentrate and she has no helper at home. And they also moved recently to other area where still they did not start to connect with the groups. And these are the things I told. And still one more thing I forgot somewhere. Okay. So
Dental,
yeah, regarding the
dental hygiene.
follow-ups, physiotherapy, she's not doing the just physiotherapy by herself, and even the follow-ups with the physiotherapists, dietitians, she's not doing. 2 months he is suffering. So I asked any recent connection with the dietitian. She said no. Again, because of the social problems. So here both are playing an equal role.
Okay. Did you ask about the dental hygiene? Was that
No, I did not ask. I wrote it here, but I did not ask.
I think that will see whatever this dental hygiene will be relevant in our case because dental hygiene, if the dental hygiene is really good, that means the mother is doing as much as she can in order to take the child, because dental problems is another problems that the child, I remember having a child when I was doing my PG, the child was in a very bad state, was brought severely malnourished. And I think when we were, the last thing I remember was that the child, the teeth falling off. So I think in this case, pertaining to the weight gain thing, I think asking for dental hygiene would be an extra point, if that can be asked.
See, in systemic review, what I say always is, what I do always is, I go from head to toe so that you will not miss anything. Like the mother did not give me about this abnormal arching of the back in the history of presenting illness. She did not give me. I asked her anything, she did not give me. But when I came to the systemic review, I asked her in a different way. Like I asked her any behavioral changes. For me, he is agitated and showing more anger in his expressions during these 2 months. This is the behavioral change. And I asked about the abnormal movements. Then she told about this arching of back. So suppose even if it is missed in history of presenting illness, you should be in an able that you extract it in systemic review. Okay. Like this. And when you go the systemic review, go fast, no problem for the things which are not relevant. But for the things which are relevant, give some time. Like go from head to toe, start with CNS, mainly is the behavioral problems and abnormal movements. Okay. Ask us in general abnormal movements. They will tell it is. If you ask fits, they may tell. If I would have asked her as fits, she would have told that her epilepsy is well controlled with sodium valproate. In this history, epilepsy is well controlled with sodium valproate. They have no problem at all. Okay, but mother is thinking this may be convulsion, but GP told her, no, this is not convulsion. But after video recording, you got my point. Already she has discussed this with the GP. So the abnormal movement here is the one which is indicating us to Sandy First syndrome, like arching of the back. Next is I wrote ENT. At that time, I started asking hearing, vision, but I would have also extracted something about the mouth oral hygiene, which I did not do. The second will come to the chest and the heart, about awareness of heartbeat. Maybe the child will not tell mother should. So I told any about heart and the lungs, anything. Then she told me about the coughing like this. So any problems in the chest, we can ask him. They may tell that they have some cough like this. Then go to the abdomen, go from head to toe so that you will not miss anything. CNS, ENT, then chest, then abdomen, then come to the limbs. In the limbs, again, if you can divide it as the muscles and the joints. So it will be musculoskeletal system. You will be extracting about the musculoskeletal system. So last but not least, don't leave the skin. I asked about skin, then she told about bed sores. If I wouldn't have asked, she wouldn't have told, right? Bed sores also is a kind of neglect. If they take care, it can be taken care, right?
Yes. Yeah.
Yeah. So all these things in systemic review, we are not going systemic. This is the problem. We ask about pee and poo, and then we will go for the behavioral things. Then we will come for the hearing and vision. Then we will go for the abdomen. Then we will come for the chest. If we do like this, we will miss the points. When you are
What
going
about
systemic
this?
review,
You were telling about poor dental hygiene. This is for to rule out the GERD or for what?
It's a CP child. It's a CP child, and the child is not. The child is completely dependent on the mother. So, when anybody is brushing their own teeth, there is still a possibility of having caries. Now, unless and until the mother is really, really dedicated, it's going to be very easy for the child to develop caries tooth. And that is a sign of neglect, and that can be used as a sign of neglect. We can say that.
Okay.
Yeah.
Okay. Signs of
Okay, as
neglect.
a
Okay. And
yeah.
if in the examination, GERD is also related with the especially posterior side of the teeth is related with the GERD. Poor dental hygiene in the posterior side of the teeth, that is related with the GERD also.
I
Just
think
want to mention.
one question in is mass that's history of fundoplication with the GT. Because before we are offering nice fundoplication, you have to make sure it's not done with the during insertion gastrostomy tube. So we'll ask about if GT done with the fundoplication or without.
One more thing, which should I maybe I didn't listen properly. He's 7 years now old, 7 years, yes. So ask about planning for school or
Yes, education has to be asked. Any special school is involved.
special school involved or distant learning or what they have planned so far for him. So that should be asked. Otherwise, in the management, you will have to tell about that at
And
least.
we shouldn't forget the community pediatrician
Yeah.
name in this issue, because I think he involves all these specialities like physiotherapy, occupational therapist, and speech and language therapist. All these he will bring together for the care of the child. The main person is the community pediatrician.
Yes, definitely. Community
Have to mention
pediatrician.
his name, which we did not mention in the MD.
And as you told that if you are thinking neglect, that was very nicely you said that about the support of the parents and other things. You should defend your differential.
So here, what is the scenario here is, one is he already has GERD, which is exacerbated now despite on medication and NG feeding. So the now offer for him is, if see every medication will have maximum dose, right? If it is reached up to maximum dose, you cannot increase even more. So the next option will be for you either gastrostomy or Nissan's fundoplication, or explore the social causes which is causing this. Maybe the neglect, they are not feeding properly, mother is busy, maybe the mother give her elder child to feed and he may not feed properly, lots of things, right? So we
Yes,
don't.
lot of things you can say this is as the last resort for this gastrostomy or fundoplication as the last. First, as you said that I will rule out if there is any negligence.
We will review the doses of this omeprazole and Gaviscon or anything he is on with the gastroenterologist. It is better with follow up with it, and also you will do the pH study for him. In the investigations, what I have written here is, if anyone wants to add, can add this pH study and endoscopy. Okay. Yeah. And also, if you want, you can rule out H. pylori, investigations to rule out H. pylori. Okay.
Yeah.
So the thing that I have written here is the pH study and upper GI endoscopy and H. pylori screen. Wait, I will just mute. Then you open the mic. Then we have to do the infection screen to rule out any infection he has. Then you will have his psychological and social evaluation. This is mainly for the parents, and evaluation of the diet. This is the main management here.
Yes. This is the main management.
This is for the investigation. Investigations, these three, upper GI endoscopy, H. pylori screen, pH incidence, and infection screen, doing CBC, CRP, cultures, including urine and chest X-ray, all.
And yes, and what about, should we ask about the modification has been done at home or not? Should we ask in this case?
For diet, you mean?
No, modification of the home modification.
No, I think we have to ask, but I did not ask. What kind
of?
No,
particular in this case. I mean to say particular in this case, we should ask in this index case, we should ask or not. He's just bedridden. Still, we need home modification. I think so.
Like without carpets or with carpets, what you are telling? I did not.
Occupational therapy.
Yeah, this occupational therapy, they involve this home modification for as the child is totally bedridden. So they are doing something like this. So he's not independent. He's totally dependent. But some things he can do by himself.
Hmm.
Home modification actually means that as the child cannot walk, okay, so
Yeah.
there will be a that kind of stair, automatic staircase,
Stair,
so
that kind of wheelchair.
yeah, and child's room should be in the ground floor or in the that floor that is close to that, so that the child can go easily to the doctor's chamber, like this.
Yeah.
So sometimes they
Also,
shift
bathroom for easy to
bathroom
Sometimes
also.
they are
clean
providing
the baby.
this wheelchair of movable wheelchair that he can
Yeah.
handle by himself.
Yeah, and also cervical collar, many things actually. The
Yeah, there are
quadriplegic
many
sibling,
things.
many things.
So
Yeah.
in this index, we should ask, I think so.
Yes. Yes. Any modification in the child's wheelchair or in the home, like stair modification of toilet.
It will help him to bring up some of the daily activities.
Activity,
Yes, yes.
Yeah.
Home modification
He
is
can
specific
ask, no
for that.
problem in the history. But if you would have asked in this history, I would have told definitely no, because they have shifted recently and there is a small baby and they have no time to take care. Okay.
Mhm.
So definitely. And regarding the management, I have written here as the medical, surgical, and the non-pharmacological. So in the medical, maybe feed thickeners you can add, but this was already done for him before. And omeprazole and Gaviscon, you will review the dose. If sometimes for vomiting can be tried with domperidone, but I'm not sure. Do they give this to this CP child or no? Prokinetics. I am not sure, but I just wrote, but I am not sure about it. But definitely I will tell omeprazole and Gaviscon, we will review the dose. Then for surgical, we will offer them for gastrostomy tube feeding or Nissan fundoplication. The other thing is we will check whether he's following up with regular physiotherapy, occupational therapy, because he has contractures as well. So physiotherapy, occupational therapy, orthopedic, speech and language, dietitian follow-up, and social support. Now recently they are not in connection, so we will give and we will offer the respite care to them. And then one more option you can give is, since the child has acute fall in the weight, and poor feeding and agitated, we will also offer him for admission to review his feeding under observation and to review his medications, and if needed to give him the surgical management plan to the parents, and for the social care also. All these are the indications for admission. Okay, so anyone wants to add to this, go ahead. The community pediatrician, I told you which I have left. Someone has written asking about home modification important, especially for CP, seizure, and asthma. Okay. So I think
Well, they didn't have pure asthma, but hyperactive airway disease secondary